Okay, here's another rambling, and this one's going to be about benzodiazepines. I'm not going to get too far into my story. All I'm going to say is that I've been prescribed them in large doses for the past 7 or 8 years of my life. I am currently in week 4, maybe 5 of going off 40 milligrams of Valium in a drastic redux. I have been weaned off before for various reasons, and those times were a lot harder for me. However, now I'm finding it to be a lot easier. So what I'm basically going to explain in this video is what are benzodiazepines, uh, what can they do for you, and what shouldn't be done with benzodiazepines. So what is a benzodiazepine? A benzodiazepine is basically a category of drugs that falls under muscle relaxants, skeletal muscle relaxers, anti-anxiolytics, meaning something that helps anxiety, uh, and hypnotics, and that's pretty much it. So hypnotic benzodiazepines, rohypnol, roofies, they're legal in America. You won't find them and don't have to worry about them that much. Rohypnol, um, temazepam, uh, those are two hypnotic examples. Then more on the analgesic side, you have Xanax, Ativan, both short acting. Now, to make more sense of that, the hypnotics are generally longer lasting, have longer half lives, meaning they stay in your system for longer times, i.e., Rohypnol is a great date rape drug, and I shouldn't say great, it just a, is used for date rape because of how long lasting it is and how potent it is. So, for example, Rohypnol lasts 24 to 72 hours, if my memory serves. Temazepam is a skeletal hypnotic muscle relaxer, which lasts about 8 hours, 4 to 8 hours, and is used for sleep as well. I call it baby Rohypnol. I took that on and off throughout my teenage years for sleep, for chronic insomnia. And then you have Ativan and Xanax, and Klonopin is another analgesic. And then, oh yeah, they're also great anticonvulsants for seizures, but that's more like Valium is the most primarily prescribed benzodiazepine for seizures, epilepsy, and things like that. So those Ativan, clonazepam, which is the same thing as Klonopin, and alprazolam and or Xanax, and lorazepam is the non-generic name for Ativan, if you were wondering, are all pretty short-acting, except for Klonopin is like about 4 hours as well. Xanax is 1 to 2 hours, and I believe Ativan is 1 to 2 hours as well. The problems with Xanax and Ativan are because of how short their half-lives are, they are very addictive, and you come off of them very quickly, and you can very easily start taking more and more and start popping them like Tic Tacs. That becomes very dangerous, and the reason that becomes dangerous is not because they're so dangerous for your body. In fact, benzodiazepines are relatively safe to take in small or high doses, especially if you have a high tolerance. Once you have a tolerance, what most people won't tell you is it's perfectly safe. Say if I was taking 10 milligrams of Valium and then slowly moved myself up to 90 milligrams, it would be perfectly safe for me to take 100 milligrams, which sounds absurd, but it's because your body has developed a tolerance. Now, when benzodiazepines become dangerous is when you stop taking them. Now, up there with alcohol, barbiturates, and I hope I'm not missing any. And you would think heroin, but heroin and opiates don't count for this one because it's all drug classes. I'm talking about all drug classes that can kill you during withdrawal. And I mean literally kill you. You will die. You won't. You may die. You have a chance. Heroin withdrawal, you will feel like you are dying. You will think you're going to die. You will be as sick as you possibly could imagine. However, you won't die. Now, benzodiazepine withdrawal will shut down your liver, will shut down your gastrointestinal system, will essentially kill you if you're on high enough dose and you cut cold turkey. That is a problem because a lot of people don't know that or understand that while getting on these medications. They don't understand that getting off them is infinitely harder than getting on them. For most people, it's so hard that they would rather just take them, and hopefully you have a doctor who is willing to prescribe you medicine so you can continue to take them, because for those who truly need them, they're a great drug, but for those who abuse them, they're not, in my opinion, worthy of taking, because eventually you're not going to feel them at all. I mean, to somebody with a tolerance, 10 Xanax bars feels the same as an eighth of a Xanax bar to a person with no tolerance. So you can imagine how much waste that is, how much excess money that goes to the pharmaceutical companies, and then how much damage that puts on your liver and your whole organs in general. And here's the dangerous part again, when you have to quit, which will happen eventually if you're keeping up with a habit that bad, is there is a list of symptoms longer than I can possibly imagine, but let me just give you an idea. When you start to go through withdrawal, you will hallucinate. If you know what LSD feels like, or acid, mushrooms, whatever you want to call any psychedelic substance, it feels like a terrible psychedelic experience. You will start to see things that aren't there. You will start to feel things that aren't there. A common one is you can feel worms squirming inside your head. You'll feel worms under your skin. You will see spiders that aren't there that you will try to smash that then aren't there, and you cannot find the body of because they're not real spiders. Um, there's just extreme dysphoria, feeling like the ground beneath you is shaking, extreme constipation, which can become very dangerous, uh, the changing of your voice, something that's called benzo belly, which is similar to what you see with what you call a beer belly from drinking a lot of alcohol, but this is all from benzodiazepine withdrawal. And that's a permanent symptom. That's something that's going to stay unless you work hard to fix that. And of course, the scariest symptom of it all is death. So to finish up this video, if you're going through hard times and you have anxiety, don't take anything a doctor's going to give you, because the odds are you can work through it yourself. And I'm sure plenty of you have taken Klonopin or Xanax and you enjoyed it, and yeah, it was bliss, it was great, you could maybe get more stuff done, or you felt relaxed enough to talk to people better. It's no better than taking a shot of liquor or a couple of shots of liquor, depending on how much you're taking. So just because it's prescribed by a doctor does not mean it's safe to take. You have to understand that doctors are trying to make money too, and they'll do anything to keep you coming back, depending on the doctor. Of course, there are good ones out there. And ultimately, you have to be your own pharmacist. You have to know what's safe for you, what's good for you to take, and how much of it you can be taking before it becomes dangerous, especially when you're coming off them, because you can, strike a chord that can perhaps bring you into a disorder that's going to affect you for the rest of your life, i.e. psychosis, i.e. bipolar, borderline personality disorder, really any disorder, mental disorder on the DSM-4 or 5, whatever one they're on right now, you can catch while you're on the downfall. You can trigger it, as they say, and you really have to be careful and knowledgeable of that. Not to mention the fact that the withdrawal can last up to a year, even 2 years, while the most intense effects will be within 6 weeks. And if you don't get treatment and you're taking, say, 10 to 20 Xanax bars, at the very least, you are going to look like the worst pizza face in the world. Your skin's going to be broken out. You'll be losing hair. I mean, you're going to look like a meth addict. And, I'm running out of time on this video. I do not have a YouTube partnership, so I can't really go much further with this. So, thank you for watching. Thank you for listening. And please don't help the system prescribe you more benzodiazepines. Just because your friend has a prescription doesn't mean you need a prescription. And don't go out there doctor shopping. Don't go out there trying to find a prescription for clonazepam, Klonopin, Xanax, Ativan, or whatever. If you continue to look down this road on YouTube videos, you will find that everyone calls it a living hell, because it is. It's not easy to get off of, so it's very easy to get on. I hate to say this, but sometimes it's better to just stick to liquor, stick to alcohol. Just, drink when the time is right. Don't wake up every morning wanting to take a pill. It's not worth it. It's really not. God bless you.